Well, Keenan and Alicia, from the pandemic to the divisive 2020 election and this endless cycle of just kind of wondering when it's all going to be over. For a young person, it's a lot. And the things that would normally bring kids, especially teenagers, normalcy right now, hanging out with your friends, going to sporting events, those are, at least right now, on pause.
During adolescence, this is a time when kids are really primed to want to explore their environments, to seek out new experiences. And being stuck at home with your parents is not necessarily the easiest way to fulfill those developmental needs.
It's one of the reasons why Dr. Hannah Schachter with Wayne State says seeing your kids glued to their devices shouldn't be unexpected right now or even frowned upon. In the onset of the pandemic, kids, especially teens, missed out on some key social milestones: prom, sporting events, graduation.
And now suddenly you have moments of hope of maybe it's getting better and maybe we're heading back there, and then suddenly that's shifting.
The CDC found that since last April, around the country, mental health-related ER visits for minors are up. The data was collected from hospitals in 47 states and tracks patients 18 years or younger. The sample found that mental health visits for kids ages 5 to 11 went up 24% compared to last year, and for kids ages 12 to 17, a 31% increase. So what can you do as parents? Keep an eye on patterns of different behavior over several days or weeks, Dr. Schachter says.
Are kids suddenly not sleeping well regularly? Are they complaining of sort of physical ailments? Where there's not a clear sort of medical origin of it, being really socially isolated and distant.
When talking about pandemic stressors with your kids, validate their feelings. And remember to take care of yourselves, physically and mentally.
Even if parents feel maybe like their kids aren't listening, they're probably picking up on more than you may think.
Now, Jan, with high school students learning remotely at least until December 8th, is there any guidance for teachers and how teachers can help?
Yeah, Keenan, one thing Dr. Schachter advised is that when you're doing those group Zoom activities, she said it would be a great idea for teachers to give students some time just to chat, not to talk about schoolwork, not to talk about their daily tasks, but just to talk, check in with each other, talk about what's going on in their home. She said something as simple as that could really go a long way. Keenan?
Yeah, for adolescents.